Hello, I'm Dr. Sajjad. I'm a gastroenterologist and I practice in Coventry and Kettering in Northamptonshire. One of my special interests is the functional bowel disorders. So I'm going to tell you about this problem, which we see very commonly in our practice. There is a new terminology for IBS. It's called disorders of gut-brain interaction. And the functional bowel disorders can affect any part of our bowel. It's not just IBS. DGBI can affect our gullet. So patients can present with symptoms of involving the esophagus. A lot of patients come to us with a feeling of lump in the throat or swallowing difficulty or chest pain. And also there is a condition called functional heartburn, and that does not respond to usual acid treatment. DGBI can also affect stomach, and patients can present with what we call functional dyspepsia, and they get discomfort after eating in the stomach area, and there is also a condition called epigastric pain syndrome, so they get more severe pain after eating. Patients can also present with belching, and that can be from the stomach or above the stomach. When it comes to the small bowel, then we call it symptoms of IBS, and that can affect small and large bowel. IBS has got different presentations. We call IBS A, that is, it affects the bowels in habit in alternating ways with constipation and diarrhea. IBS patients can just present with diarrhea and or constipation. The symptoms are after chronic and associated with abdominal pains. Also, DGBI can affect the back passage, and patients can present with pain in the back passage, which we call proctalgia fugax. So it encompasses a lot of symptoms, and it's not just IBS. Functional dyspepsia and IBS are although the more common presentations. There are a number of conditions that can mimic functional bowel disorders, and we like to exclude them by doing investigations, by doing routine blood tests. There is a condition called celiac disease, which is very common and can present with IBS-like symptoms. Another condition is small intestinal bacterial overgrowth called SIBO, in which the balance of gut microbiota gets more towards the bad bacteria, and that needs to be treated with antibiotics. So if you do get symptoms of IBS or functional bowel disorders, you need to consult your doctor. Symptoms are after chronic and difficult to treat, and you will the assessment and management will often involve a detailed history and assessment by an experienced gastroenterologist. Diet has got an important role in the symptomatology of functional bowel disorders, but it is mainly affecting the part of functional dyspepsia and IBS. There's a lot of evidence that gluten and lactose can produce symptoms of IBS. There is a condition called lactose intolerance, which is not actually a functional disorder, but due to deficiency of an enzyme, and patients get symptoms which are very similar to IBS. Celiac disease is gluten sensitivity, and that can also produce IBS symptoms. But there is also a condition in which patients, although they do not have celiac disease, but they have celiac sensitivity or wheat sensitivity, and after avoidance of wheat or gluten leads to improvement of symptoms. Also, other sugars like fructose and sorbitol and high fat by foods can cause bowel symptoms. The last dietary management we resort to is going to a low FODMAP diet. But initially, we advise to go on a healthy diet. And then if does not work, then we go through an elimination food process. Uh, there are medications because functional bowel disorders, one of the causes hypersensitivity of the bowel. And there is a two-way signaling between our brain and our gut. So our brain can send abnormal symptoms to bowel and making it more hypo or hypoactive and more sensitive to food when we eat. And we can use medications to dampen these abnormal symptoms. And these medications are called neuromodulators. Initially, when you consult your doctor, your doctors will give you first-line treatment to relieve your symptoms like antispasmodics and painkillers, and give you a lifestyle management advice. But if this management does not work, then you will need to be referred to a gastroenterologist for an holistic approach and investigations of your symptoms and management advice.